If you've been told that you have sleep apnea, chances are someone also mentioned the dreaded word, the CPAP machine. But let's be honest, it's not for everybody. The mask, the noise, the discomfort, sometimes it feels more like you're getting yourself into trouble than you're giving yourself help. But the good news is CPAP is not your only option. That's right. So with sleep apnea, it's a condition where your airway collapses or gets blocked during sleep. You're laying back and your tongue falls back in this area here, it gets blocked. So it leads to pauses in breathing. You've got poor sleep quality. That leads to daytime fatigue. And then there's long-term health risks like heart disease and high blood pressure. So they're serious things. Untreated sleep apnea is not just about snoring. It can seriously impact your health. So let's talk about alternatives. Did you know that there are oral appliances? They're called mandibular advancement devices. Kind of a lot of words to say, but basically what they are is they're custom made by dentists, and they work by pulling your lower jaw forward slightly, which then helps keep the airway open. It's much smaller and easier to travel with than a CPAP. There's no electricity or anything involved. So that's one option that people with mild to moderate sleep apnea can use. Then there's positional therapy. Think about it. If you're laying on your back and gravity is pulling this down so that you're blocking your airway, then what happens if you sleep on your side? Well, again, for mild to moderate sleep apnea, if you move to sleeping on your side, if you happen to be a back sleeper, you may be able to alleviate some of that blockage. So some people only experience sleep apnea when they're lying on their back. There are special belts, pillows, or even smart devices that you can wear that help you to prevent you from sleeping on your back and make you sleep on your side. They're simple, they're low tech, but surprisingly effective. Another option is surgery. Now this is for severe sleep apnea, or maybe there's structural issues in your throat or in your airway. So a surgeon can remove excess tissue in your throat, and that corrects nasal blockages or other types of blockages. And there's more advanced procedures like Inspire. That's a surgically implanted nerve stimulator that keeps the airways open. These are not first-line treatments, but they are effective for people who cannot tolerate CPAP. Then think about nasal expander strips and dilators. For mild cases or people who just snore, widening your nasal passage can reduce resistance and improve airflow. So you know those strips that you put on and they're designed to kind of pull things open a little bit? That can help some people in mild cases. And then lifestyle changes. Yeah, these are a little bit harder. So weight management. Oftentimes, if we carry extra weight, some of that fatty tissue ends up in this area here, and then that cuts down on our airflow. So if we reduce the fatty tissue by losing weight, our airflow can open again. So there's a lot of clients that I have, a lot of people that I know who've done just that. They've reduced their weight and they've gotten rid of their CPAP, they've gotten rid of their sleep apnea. So even modest weight loss can really help with this. So it's something worth considering. Exercise is good because even if you don't have weight loss but you exercise, studies show that physical activity improves your sleep quality and your apnea severity. How about avoiding alcohol and sedatives at night? Now, that's kind of a strange one because people with insomnia and sleep apnea want to take a sedative, they want to sleep, but medications are really not the answer to insomnia. Medications are covering or masking the problem. They're not fixing the problem. When you use alcohol or sedatives, what they actually do is they relax your throat muscles, and then that makes your airway collapse even more. Quit smoking. I know there's many people who smoke who say they wish they could quit smoking, and it's very hard to do. And yes, it's very hard to do. But if you're able to succeed, it can help in reducing the sleep apnea as well as a lot of other health concerns. It reduces inflammation and swelling in the airways. You get better sleep hygiene that way. And if you get on a regular sleep schedule and you reduce your screen time before bed and optimize your sleep environment, these are additional things that you can do to reduce your chances of having sleep apnea. So, if the CPAP machine isn't working for you, don't give up on better sleep. From oral appliances to positional therapy, lifestyle changes, and even surgical options, there's many ways to take control of your breathing at night. So talk to your sleep specialist about which option fits your lifestyle. Sleep apnea is serious, but so are you, and you deserve to wake up refreshed. Now, I want to remind you that this video is for educational purposes only and not a substitute for medical advice. Please consult a qualified healthcare professional for personalized recommendations, but these are the things you should be asking them about. So go out there, take charge of your situation, and improve your sleep apnea. And when you do, please give us your comments below. We want to know what information people find helpful. Thank you.